Hey friends! Welcome to our channel. In this video we will talk about thyroid glands and few more interesting facts about it. Number 1. What is thyroid gland? The thyroid gland is a body organ located in the front of the neck. It has two lobes, one on each side of the trachea. The lobes are connected by a thin band of tissue, while a network of blood vessels surrounds the gland. The thyroid takes iodine from the blood and uses it to make the active hormones thyroxine, also called tetraiodothyronine, and triiodothyronine. An inactive form of thyroid hormones is stored inside the lobes in small chambers called follicles. Thyroid hormones control the body's cell metabolism. When thyroid hormones are released into the bloodstream, cells increase the rate at which they convert oxygen and nutrients into energy and heat for the body's use. During a child's development, thyroid hormones stimulate an increase in growth rate. Release of thyroid hormones also increases the activity of the other hormone-producing glands. Number 2. What do my thyroid hormones do for me? The tetraiodothyronine and the triiodothyronine secreted directly by the thyroid gland influence the metabolism of your body cells. In other words, it regulates the speed with which your body cells work. If too much of the thyroid hormones are secreted, the body cells work faster than normal, and you have hyperthyroidism. If you become hyperthyroid because of too much secretion of the hormones from the thyroid gland, the increased activity of your body cells or body organs may lead, for example, to a quickening of your intestines so that you have frequent bowel motions or even diarrhea. On the other hand, if too little of the thyroid hormones are produced, the cells and organs of your body slow down. If you become hypothyroid, your heart rate, for example, may be slower than normal and your intestines work sluggishly, so you become constipated. Number 3. What are the common symptoms? The most common symptoms are tiredness, feeling cold, weight gain, poor concentration, depression, weight loss, heat intolerance, anxiety, and sometimes sore and gritty eyes. Number 4. Which type of disorders are there? Thyroid eye disease. This affects some people who have an overactive thyroid due to Graves' disease. Nodules or swellings. These lumps can stop the thyroid gland from working properly, or are simply uncomfortable. Thyroid cancer. This is very rare, but it is important to ask the doctor to check any lump in your neck. Number 5. Who all are affected by thyroid disease? On a worldwide scale, approximately 200 million people have some form of thyroid disease. People of all ages and races can get thyroid disease. However, women are 5 to 8 times more likely than men to get problems with their thyroid function. Number 6. What causes thyroid disease? There are various different factors causing hyper and hypothyroidism. The following conditions cause hypothyroidism. Thyroiditis is an inflammation of the thyroid gland. This can lower the number of hormones produced. A special form of thyroiditis is Hashimoto's thyroiditis. This is a genetic disorder caused by diseases of the immune system and can be passed from one generation to the other. Nutrition also impacts your thyroid functions. Iodine deficiency causes hypothyroidism. This is a worldwide problem affecting approximately 100 million people. The following conditions cause hyperthyroidism. First, Graves' disease is a condition where the entire thyroid gland might be overactive. This problem is also called diffuse toxic goiter. Second, in contrast to iodine deficiency, excessive iodine intake may have negative effects on your thyroid. Excessive iodine is found in a number of drugs such as amiodarone, Lugol's solution and some cough syrups. This might cause the thyroid to produce either too much or too little hormone in some individuals. Number 7. How is the thyroid gland controlled? There has to be some sort of mechanism that regulates very carefully the amount of tetraiodothyronine and triiodothyronine secreted by your thyroid gland so that the normal, amounts are manufactured and delivered into the bloodstream. The mechanism is very similar to that which regulates the central heating in a house where there is a thermostat in, say, the living room, which is set to a particular temperature and which activates the gas or oil-fired furnace, or boiler that heats the thermostat consists of a little gland, called the pituitary gland that lies underneath your brain in your skull. The pituitary senses the level of thyroid hormones in your bloodstream, just as the thermostat in your living room senses the temperature. Under normal circumstances, if the level drops just a little below normal, the pituitary reacts by secreting a hormone called the thyroid-stimulating hormone, also known as TSH, and this hormone activates the thyroid gland to put out more tetraiodothyronine and triiodothyronine. Number 8. Thyroid treatments. First, thyroid surgery. A surgeon removes all or part of the thyroid in an operation. Thyroidectomy is performed for thyroid cancer, goiter, or hyperthyroidism. Second, antithyroid medications. Drugs can slow down the overproduction of thyroid hormone in hyperthyroidism. Two common antithyroid medicines are methimazole and propylthiouracil. Third, external radiation. A beam of radiation is directed at the thyroid, on multiple appointments. The high-energy rays help kill thyroid cancer cells. Fourth, radioactive iodine. Iodine with radioactivity that can be used in low doses to test the thyroid gland or destroy an overactive gland. Large doses can be used to destroy cancerous tissue. Hope you all like the video.